Hi, I am Dr. Nischal, practicing as a consultant dermatologist at Nirmal Skin and Hair Clinic in Vijayanagar, Bengaluru. Fungal infections are quite common across all age groups now. And it is not only particularly in men, even women are prone for fungal infection. And this incidence has kept on increasing recently. Why is it happening like that? It's mainly because of two reasons. One is because of our lifestyle, and second thing is because of the virus factor, fungus factors. What's happening is whenever there is a lot of dampness in the skin, or it could be because of intense physical activity, or some people have a tendency to sweat too much, or sometimes you're not able to maintain hygiene regularly. In these situations, the fungus thrives. So hence, commonly the fungal infections usually start wherever there is a lot of dampness. For example, like in the underarms, or in the groins, or in the lower abdomen. Or rarely it can also happen in other areas like on the posterior aspect of your body, that is on the back and buttocks. For example, like people who are into continuous driving profession, for example drivers. Okay. Or sometimes when people are sitting for continuous long hours and working, like for example software engineers, or it can be a call center employee. So these people, the sweat tends to accumulate on the posterior aspect of body, and then that causes dampness, and this can increase fungal infection. So wherever there is dampness, fungal infections are more common. Not only that, it can also happen between the toes or the fingers. Between the fingers, it is more common when we are washing our hands very frequently or continuously involved in wet work, like for example maids or people who work in service industry like hotels. So in them, it's also common in hands as well as in the feet. So wherever the dampness is there, fungal infections are more common. Second aspect is, nowadays the fungus is also becoming very resistant to treatment. That's happening mainly because of incomplete or inappropriate treatment. Commonly what happens is people get a rash, itching, and what they do is over the counter they purchase some creams. And these creams may not be the right creams for the infection. So when that happens, the fungus starts developing resistance. Commonly topical steroid creams are used because the moment you apply your steroids, inflammation comes down. Okay, it suppresses the immunity. So all itching, redness comes down. You get a symptomatic relief for a few days, but the fungus starts thriving beneath that cream. So this causes more of fungal resistance and the infections are increasing. So whenever you have fungal infection, most important thing is keep yourself clean. Hygiene is the most important thing. So take bath daily 2 times. Take bath with lukewarm water. Okay, don't take very hot water because you tend to sweat immediately after a very hot shower. And before you put on your clothes, dab it dry completely. Don't be in a hurry. Dab your skin dry, then wear your clothes. Take bath daily 2 times and change your dress also 2 times. Maintaining hygiene is the utmost important thing to prevent fungal infections and also for faster clearance. And whenever you're putting your clothes for washing, reverse the clothes, because when you have fungal infection here, it is stuck on the inner aspect of your clothes. So when you reverse and wash, the chances of you washing it off is actually good. And if you have extensive fungal infection, it's a good advice that you wash your clothes separately, because if you mix your clothes with others, probably they may contract a fungal infection. So it's a good practice that if you have fungal infection, you wash your clothes separately. And when it comes to the inner wear, always wear innerwears which are comfortably fitting, which does not apply too much of pressure, because sometimes the elastic or the rims of the innerwear, they rub on the skin and they increase friction and fungal infection spreads. Wear something which is comfortable. And most important thing is, when you have an infection, don't ignore. Consult a dermatologist and take proper treatment. Nowadays the treatment goes on for 3 to 6 weeks because they are more resistant to treatment. But if you get it treated properly, yeah, you can get rid of it.